What we know about the ransomware attack on Ascension hospitals and clinics in Wisconsin and across the U.S. There is no timeline for restoring computer systems disabled by a cyber attack on the national health system Ascension that has resulted in cancelled appointments, delays in care and other major disruptions. The cyber attack has had major repercussions for patients across the 18 states where Ascension operates. The health system has 17 hospitals in Wisconsin, in addition to many clinics and other healthcare sites, where healthcare workers still cannot access the medical record system critical for documenting patients' medical history and managing their care. The ransomware attack was first detected on May 8. A ransomware attack typically involves cyber criminals locking their target out of computer systems and demanding payment in exchange for returning access. They often steal sensitive information that they then threaten to release as an extortion tactic. Ascension has not disclosed whether a ransom was paid. The type of ransomware involved in the attack is called Black Basta, also the name of a group of cyber criminals notorious for using ransomware. The effects of the cyber attack are system-wide, affecting Ascension facilities in Wisconsin and across the country. Ascension has hospitals and other health care facilities in 18 states. Health care workers at Ascension hospitals and other facilities do not have access to the electronic medical record system, known as EPIC, used to document patients' medical histories and keep track of their conditions, prescriptions, allergies and other important medical information. Systems used to order certain tests, procedures and medications also are not working. Healthcare workers are using paper records to track patient conditions, write prescriptions and order tests and procedures. Some patients' appointments have been cancelled in light of the situation. Ascension has temporarily paused some non-emergent procedures, tests and appointments while the health system works to bring computer systems back online. Ascension has not disclosed a timeline for getting its systems back up and running again. In an email sent to Ascension healthcare workers on May 9, Ascension CEO Joseph Impichich said it was unclear how long it will take to get all systems back on track. Another physician who works at Ascension Wisconsin hospitals said healthcare workers are preparing for the situation to last weeks or even months. Ascension is working with cybersecurity experts with the firm Mandiant and others to investigate the attack, contain it and help determine what information, if any, was compromised in the attack. Once the cyber attack was detected, Ascension took steps to contain the damage and urged its business partners to temporarily sever online connections to its system. Following the attack, Ascension notified the FBI, the Cybersecurity and Infrastructure Security Agency and the Department of Health and Human Services. They also has shared information about the attack with the Health Information Sharing and Analysis Center, a group of healthcare providers that shares information about cyber threats and physical threats to the health sector. Ascension advised patients with appointments to still go to them unless they hear otherwise from their healthcare providers. The health system also is encouraging patients to contact their provider before their appointment. Ascension encourages patients to bring notes on their symptoms and a list of current medications and prescription numbers or prescription bottles so that healthcare providers can call pharmacies for patients' medications. Cyber attacks are becoming increasingly common in healthcare, often affecting protected health information along with other data, such as account numbers, social security numbers, phone numbers and addresses. The Health Information Sharing and Analysis Center published an advisory Friday warning that hackers with Black Basta had recently ramped up attacks against the healthcare sector. Another, joint advisory was issued Friday by the FBI, the Cybersecurity and Infrastructure Security Agency and others, to provide information on Black Basta and urge healthcare providers to take recommended steps to prevent ransomware attacks. The advisory explained that ransom notes do not generally include an initial ransom demand or payment instructions. Instead, the notes give victims a unique code and tell them to contact the ransomware group on the dark web, a part of the internet only accessible by a specialized web browser that allows users to remain anonymous and untraceable. Typically, the ransom notes give victims between 10 and 12 days to pay the ransom before the ransomware group publishes their data on the dark web. Healthcare organizations are attractive targets because of their size, their heavy reliance on technology, their access to personal health information and the unique impacts from patient care disruptions. Earlier this year, Change Healthcare, part of the health giant UnitedHealth Group, was hit by a cyber attack, one of the worst hacks to hit U.S. healthcare, that caused widespread disruptions in payments to doctors and health facilities. UnitedHealth ended up paying a ransom of $22 million in cryptocurrency. UnitedHealth was lambasted in congressional hearings for the cyber attack and a lack of security measures to keep hackers from compromising sensitive patient data. The incident raised questions about the vulnerability of the healthcare sector to cyber attacks. Thanks for watching. Check out our website to find out how we can protect you from ransomware, and remember to like and subscribe for more cyber news and wisdom.